Hi everyone, and welcome to this week's video podcast. I'm here at Alpine Physical Therapy with special guest Brace Hayden, who is a physical therapist at Alpine, and he has taken some intensive training in the area of vestibular, balance, and dizziness, and has begun what is called Alpine Physical Therapy's Vestibular Dizziness Clinic. We're here to talk about this clinic, and Brace, just want to say thanks for being here.
You bet. Thanks, Brent.
You know, I think people out there may be wondering what vestibular or the vestibular system is. Can you kind of define that for our viewers?
Sure. Your vestibular system is a bit of, it's one of your senses, and it's actually draws in a couple of them, but kind of the easiest way is, you think of how your eyes work and your nose work. Your vestibular system is located in your inner ear, so it's actually kind of located in the back of your ear here, encased in bone, so it's kind of hard to see. But the vestibular system takes in your visual information, what your eyes are telling you, your proprioceptive information, kind of what your joints are telling you, and it's also got a bit of your body's movements. So it sends it to a relay station, so we get various inputs, sends it to a vestibular relay station in your brain, and then it comes out as how your balance works and how your eyes move. So it's an interesting system that people don't usually associate with physical therapy.
I was going to say.
But it's an interesting area that kind of combines some orthopedic work and as well as a neurological system. So.
Well, I've been in the field of physical therapy for 20 years and have worked with patients who have balance disorders, maybe dizziness, but what you have done is taken this to an entirely new level with the certification that you took in Atlanta. Can you speak to that a little bit?
Sure. There's a course out of Emory University that they pull together some of the big research physical therapists and neurologists, and it's an intensive week-long course at Emory University in Atlanta, and you leave there with some competency testing to say you've indeed taken the classes and passed the tests, and it's rigorous, but it just gave me a really good feel for making this a specialty area, and I felt Missoula, as a fairly large community, lacks in some vestibular therapists, and in the physical therapy world we see it all the time, people with balance issues, people with dizziness. And we'll be treating necks and seeing other things, and it really dovetails well into people saying, oh yeah, I've been stumbling around and I don't really know what's going on. And so this course just gave me a really good feel for how we can better assess the vestibular system and really specializing in how we can treat it and improve people's confidence in their movement, their balance, their walking, and reducing dizziness.
How do you go about rehabilitating the vestibular system?
Well, the vestibular system, as it is an interesting pathway, it's really, first of all, seeing how their body is responding to something going wrong with it first. And often, the sense of dizziness is a kind of a vague term, and it means something different to everyone. So first, it's finding out what is causing this feeling of imbalance or lightheadedness or nauseousness, finding out what side of the inner ear is affecting them. Sometimes it's both, and there's a whole spectrum of people with deficit or low function in their inner ear. Or another really common one we test and we look for is a benign positional vertigo, and BPPV, it's benign positional paroxysmal vertigo, just meaning essentially there's a storm of activity and something going wrong in the vestibular system. So we look at what is going wrong, and we have some oculography testing I'll talk a little bit about, and we try to evaluate the ear that it's in, and then the next steps we really take is how is this affecting their life, like we do in physical therapy, how is it affecting their motion, and then how can we rebuild their system to compensate for it or reduce their reaction to, say, the crystals in the ear for the benign paroxysmal positional vertigo.
BPPV, I've heard that term a lot. And as far as the goggles, I always heard, I think about people that do these certification courses using specialized goggles and how that might improve the ability to diagnose or to treat.
Sure, the oculography goggles just means a video of your eye, and it's completely black, and they look like scuba goggles, and the person with them on doesn't see anything. And what we're looking at with videoing the eye and how it responds to head movements is basically testing the vestibular system and seeing how they respond to head movements. And if there's something going awry, there's some really interesting responses of how the eye moves with positional changes of the head. And based on that information we get, it really helps us get a more accurate diagnostic to their reaction of how their vestibular system is responding. And from that, we base our treatments on improving it. And then we can use the goggles for retesting it. And it allows us to record it and kind of go back to this as a baseline measure, and really helps us get a cleaner treatment method for improving what's going wrong.
It's an amazing piece of technology. You know, for years, we've kind of done what we thought was for the best interest of the patient in terms of, you know, head movements and so forth. But the oculography seems to take it to a whole new level.
It does, and it really helps us as therapists be more accurate. It helps us get a concise vision on how they're responding to this. And we don't feel like we're shooting in the dark as much. And I think as far as trying to build a vestibular clinic and an outreach to Missoula and improve people's balance and their dizziness, it really helps us get a cleaner results, and we're having great luck with it.
How would a person know that he or she is the right patient maybe to sign up for something like your program?
Yeah, sure. Generally the balance is a tough thing. So we see a lot of people that come in through their primary care provider, some through neurologists, or some through direct access. And I'm waking up with when in the morning when I move up to sit up, I'm getting extreme dizziness, and so often some of it's direct access right in through people's just having difficulty with their balance, or they've been feeling fuzzy or lightheaded, and it can be a number of things that isn't necessarily in the scope of PT, like medication reactions or a concussion, but a lot of it is definitely in our scope, and we are bringing in people from all walks, ages, with various things going on with their vestibular system.
How do you recommend our viewers, if they're considering or thinking they might need it, what's their next step? What should they do?
Well, depending on your insurance, you can get access through physical therapy through your primary care provider, or if you have direct access, you can talk to us and we can evaluate it and see if it's something that looks like it's treatable in physical therapy.
Fantastic information, Brace. Thanks for being here. Is there anything else you're thinking about that you want our viewers to know about the vestibular and dizziness program at Alpine?
Well, I'm excited that it's up and running, and we're really looking forward to reaching out to Missoula and reducing falls and improving people's dizziness and their confidence in getting around, as it's very crippling and limiting in how people move. So we're thrilled to get it off the ground and reach out to the Missoula community.
I think too, along that line, just to let people know, we are in the process of putting together the webpage on the alpineptmissoula.com website. So soon you'll be able to go there under specialties and find this entire program that Brace has put together. Just want to commend you, Brace, for taking this on. It's a huge piece in our community. I know people are going to benefit, and I appreciate you doing it. And I want to thank all our viewers for joining us today on this interesting topic of vestibular dizziness, particularly the clinic at Alpine. Thank you.